Hi everyone, this is Sean with the Western Mass team of the MassSupport Network, here with your COVID-19 update for Tuesday, October 6th, 2020. So looking at cases around the world, worldwide we saw an additional 2,150,000 cases in the last week. That is a rate increase of 150,000 additional cases over last week. As cases continue to rise worldwide. Here in the US, also seeing cases rise with new cases totaling 310,000, which is 10,000 additional cases over last week. Here in Massachusetts, we saw about 4,300 cases in the last week, which is an increase of about 300 new cases. We're definitely on the rise here as well. Worldwide, when it comes to deaths, we saw about 43,000 new deaths. There is a steady increase there, about 5,000 more than we saw last week. Here in the US, deaths are more or less staying about the same, with about 5,000 per week. In Massachusetts, we saw 115 new deaths, which is, they tend to fluctuate. Some weeks they'll be a little under 100, some weeks a little above, still staying fairly low there. Looking at these trends visually across the country, testing is still up, but cases are rising as well. And you can see that hospitalizations are on the rise as well across the country, as we had almost dipped to our lowest point since the beginning of the pandemic, but have seen a rebound in the last couple of weeks. Deaths are more or less level after a period of falling for a while there. So looking at this new rebound in cases, looking at it by region in the United States, you can see that the South is really the only region that is dropping off after their particular, especially places like Florida and Texas, which have significant reductions in case counts from where they were over the summer. But just about everywhere else is on the rise. You can see definitely here in the Northeast and the Midwest and the West as well is kind of a little bit of plateau there, but had a significant rebound from that dip that most of the country saw a few weeks ago, which was probably testing based rather than actual decrease in cases. But so this just shows these as absolute values because all these regions have different populations. This is what it actually looks like if you adjust the number of cases for the population of that region. So this is adjusted per million people. So as you can see with that, the Midwest is having a very severe outbreak, especially Wisconsin, I believe, is currently the hardest hit in terms of raw numbers, but the Dakotas are also going through significant outbreaks by population. But also look down here at the Northeast, we are seeing a steep rise. Now it's not a lot by population there compared to the other states, the other regions, but compared to where we were just a couple of days ago even, it is a significant rise. So some of this may be related to school reopenings or just cooler weather driving people indoors. So let's move on to the developments. Well, first of all the news is canceled as the White House cluster continues to spread. As an increasing number of politicians, staffer, press, and others are infected with COVID-19 following the president's positive test announcement on Friday. In addition to the President and First Lady, people who you've heard of who've been infected, of course, there are going to be many reporters, staff, housekeeping staff at the White House who will be infected, whose names we'll never learn. Just heard about them as numbers. But people you've heard of include Chris Christie, Hope Hicks, 3 GOP senators, the President's campaign manager, the RNC chairwoman, and the White House press secretary. The press secretary is actually an interesting case as she tested negative for 5 days in a row before receiving her positive test yesterday. That just shows that it can take a while before there is enough virus in your system for a test to pick it up. So one negative test really isn't enough to say that you're free and clear if there's been exposure. You have to give it some time and test repeatedly. So in other news, the CDC has acknowledged aerosol spread. You may remember a couple of weeks ago, they briefly updated their COVID guidelines to acknowledge aerosol spread and then took them down a couple of days later saying it was a draft. That draft has finally been published. And the guidelines acknowledge airborne transmission, stating, quote, COVID-19 can sometimes be spread by airborne transmission, and highlighting enclosed areas with inadequate ventilation. They still consider close contact to be the primary means of transmission, however, saying that it is only sometimes that aerosol transmission is a factor. They continue most of the same guidelines, but they say that you should wear a mask, quote, when around others, unquote, not without any kind of thing about distancing there. You should be wearing a mask when you're around others. And they have started to highlight ventilation as an important infection control measure. So that's because it's taken a long time. There's been a lot of scientists pushing for the acknowledgement of aerosol transmission to be recognized as an important factor in COVID transmission. And it is almost certainly the cause of every one of the super spreader events that we've heard of. And more data is showing that COVID is really spread by those super spreader events rather than by individual person-to-person contact like the flu would be. So this just, as these guidelines update, it will hopefully give people a better understanding of how to mitigate spread. There have been no updates in vaccines over the last week. Things are deep into their trials right now, so we shouldn't expect to see any or too many changes along these levels until we get any big announcements, which I don't know. Hard to say when those will be coming. There's a lot of politics surrounding that, so I won't go into it. But that's where things stand right now with 11 projects in phase 3 in large-scale efficacy trials. And you can always find the sources for the data here on COVID tracking project. I like to use the New York Times for the raw numbers, and mass.gov has Massachusetts statistics. For more of the MassSupport Network, you can find us online or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.